What's up, everyone? Dr. Webb here. Today, I'm going to talk about physician assistant PA versus medical doctor MD, and my thoughts on them, both of them, and kind of go over some pros and cons of both of them. All right. For those of you who don't know, a PA is a physician assistant who works under a licensed physician. It requires 4 years of basically a bachelor's degree, 4 years of a undergraduate degree, plus 2 to 3 years of a graduate program, physician assistant program. They can prescribe medications, they can treat patients, they can participate in surgery, they can work in the ER, clinics, they can assist with deliveries of babies. They can pretty much work in all the different specialties that are out there in medicine. The pay, depending on the location that you're in, can range from $70,000 to $100,000 per year. Some people may make less than that. Some people may make more than that. It just depends on what specialty you work in and also location in the United States that you're in. There are approximately, I believe, 140, 150 PA programs out there as of from my last reading and kind of researching this. And like I said, it takes 2 to 3 years of clinical work as well as classroom work to become a PA. A medical doctor, MD, you go through undergraduate for 4 years of medical school, and everyone does a residency that ranges from 3 years to 8 years. 3 years like pediatricians, internal medicine, some programs are 3 years, emergency medicine, some programs are 3 years, and then you have neurosurgery, which can be 7 to 8 years. Orthopedic surgery is 5 years, and most people do a fellowship additional year, so that's 6 years. The pay can range depending on your specialty, whether you're private practice versus academic, what part of the U.S. you live in. It can fluctuate and range from a lot of different. It's very variable, but I would say on average, $200,000, $300,000, all up to $1 million. So some physicians make. Some people make more. So it's hard to give a figure for doctors because it just depends on how many procedures you do, how many patients you see, whether you get ancillary income from radiology or from different services that you provide. So there are lots of different medical schools out there. I don't know the exact number, but I would say hundreds of them. And like I said, you go to school for a long time. So people always ask me, what are my thoughts on PA versus MD? I don't have a really set kind of thought or I think it basically you have to decide that yourself, and if you have to kind of weigh the pros and cons of each. I would say some cons of being a PA is you have to work under a physician. You're called an assistant. You're a physician assistant. If you're okay with that, that's fine. Your autonomy depends on who you're working with, whether they're comfortable with you doing certain procedures or seeing patients alone. But then there's a physician who's always over you. Other cons are it can be quite variable depending on your day, whether you're in surgery or whether you're in clinic. It can change. It can fluctuate. I would say some pros of becoming a PA are you have a good lifestyle. Most of them work Monday through Friday, and then they work. Most have weekends off. Some people may take call. It just depends on the location and type of practice that you're in. Some other pros, you do get paid fairly well. You only have to go to school for, like I said, 4 years of college and then 2 to 3 years of graduate school. And they have a fairly high satisfaction rate between physician assistants. A study that came out just showed that. For MDs, the cons, school is long. I've been in school for about 12 years so far, and I still have another two to 3 years to go. So schooling is long. Tuition can be very expensive. The average medical student comes out with debt, $150,000, $200,000 in debt. The hours are long. You work a lot of hours. Right now I'm on trauma surgery, And I just calculated how many hours I worked the last week, and it was 105 hours. That's not kind of predictive of residency in general. It's just on a busy trauma surgery rotation, you're going to work a lot of hours. So that can be a downside. And you don't get to spend as much time with your family. The work-life balance can be a little bit more dismal. Some pros of becoming an MD: you have a lot of autonomy. You get to practice medicine and treat patients alone. If you're in private practice, you get to make your own schedule. You get to open your own practice, start your own clinic, surgery center. There are lots of different things that you can do as an MD that you can't kind of necessarily do as a PA. So those are my thoughts. I think it also depends on where you are in your life. A lot of people can go to PA school because they may be in their 40s or in their 50s and still become a PA. But a physician, it may be a little bit more challenging. I would say the work-life balance is better as a PA than an MD. You will work a lot more hours, take a lot more call, depending on your specialty as an MD, but you get paid more as a MD versus a PA. Almost triple the salary, almost times 4 or 5 times the salary, depending on what your specialty and where you're located. So those are my thoughts. If I had to do it all over again, I would definitely choose MD again, just because I want to be the boss. I like kind of calling the shots. I like the autonomy. I like being a surgeon. So I think the years that you have to go through this, I think it's worth it to me. It may not be worth it to a lot of other people out there. Tuition, loans they're quite expensive, but I think in the long run it'll pay off in the end. So find something you enjoy doing, whether that's PA, whether it's an MD, whether that's NP, whether that's RN. Just find something that you enjoy doing and go after. Don't let someone else make that decision for you, because there are going to be a lot of people out there trying to talk you out of your dreams and goals. But you just have to decide what you wanted to accomplish and then go after it. This is Dr. Webb. You guys have any more questions, email me at overcometheoddsbook@gmail.com or hit me up on my website, AntonioWebbMD.com. See you next time.